great filter that you can go ahead and throw onto your like shower head. That's a great way to filter it out, and I would definitely go with that. That'd be the way I'd go with it. Just go ahead and put that on there, and that would be the way to go. So again, I appreciate you guys being here. For those of you guys that don't know me, again, I'm Dr. Dylan Greeney, 512 ATX. Thanks for being here, man. Love seeing some of the fellow like long timers here in the chat. You guys rock. So yeah, we're gonna do some Battlefield 6 and that, but I'm gonna answer you guys skincare questions too. Rosacea on the nose, we talked about a little bit. Lasers for redness. Not a dermatologist, thanks for hopping on. And also NAMC, I got Eskin filter, it worked wonders. So yeah, if for the person asked about hard water, Eskin filters are awesome. Also Cure. So Eskin and Cure, I've actually personally tried both of those filters for hard water. It's really good, gentle on the skin. Obviously you can get a whole house water softener too, but that's kind of like crazy. It's a lot. Mexican filters, I'm not familiar with any of those, honestly. So I don't know about those, but you know, I haven't tried them. I don't know. I don't know where the Eskin ones come from or the Cure ones, to be honest with you. Acne hyperpigmentation. If you guys have got dark spots on the skin, and funny enough, I just did a live bulletin, and the number one thing that was happening on people's skin that they were worried about was actually that it actually was the dark spots. So the best product out on the market right now for dark spots is Remedy for dark spots. So Remedy for dark spots is going to be your number one option. So Eskin comes from Idaho, family owned. That's awesome to hear, actually. That's amazing. I mean, like I said, I've got an Eskin in like my upstairs bathroom that's like right here by my stream setup, and then downstairs I have a Cure one. What do you think you were going to match into when you're finished with med school? So I went into med school knowing I only want to do dermatology. I had my personal statement for medical school. I want to do dermatology like throughout. I was actually a nurse before I was a doctor. I was a military veteran too. So I joined the military right out of high school. I became a combat medic in the Army, and then I ended up going to medical school and becoming a dermatologist. Big skin tag on the eyelid. So that's always a frustrating place to have them. Skin tags on the eyelid, the best way, come in, just get it numbed up, get it snipped off. Usually we'll do a little bit of cautery there just to make sure it's not going to bleed, not going to bother you, you know, so you can kind of do that kind of thing. But yeah, that's really the way to go. So yeah, so let's see here. Let me get back in this so we can get going. So what can I do for psoriasis? So for psoriasis, there's a lot of different options you can do for psoriasis. Psoriasis, you know, the mainstay of psoriasis treatment really is going to be topical steroids. Like that's your main way we go about it. Topical steroids is like a real common thing to do. 111 Skin, I haven't used a ton of their stuff, but overall, great products. So you know, I know they're, if I'm thinking the same brand, I think they have some sunscreens and that kind of thing. I think I've tried some of those, but face is getting darker, how to lighten it. I mean, the number one thing that's going to darken the skin really is going to be that like sun exposure. So you want to make sure you're wearing great sun protection. Like that's going to be your number one key thing I would recommend for you. So that's going to be your number one most important thing, is that I would definitely make sure you're wearing like great sun protection. You want to use SPF 30 to 50. Cystic acne, there's not a lot you guys can do for it outside of Accutane, but I also find that a lot of people use the term cystic acne kind of like loosely. I think a lot of people don't really know what actual cystic acne is. So, you know, that's the tough part about it, is that a lot of people don't quite understand what actual cystic acne is. But if you have true cystic acne, like you're pretty much going to have to get Accutane. There's not like a real good way around it. What's the best moisturizer for women over 40? I'm a big believer in just CeraVe moisturizing lotion. However, as the winter marches on, I have become a huge fan of Kiehl's overnight rehydrating mask with squalane. It's thick, it's rich. So for the people that get very like kind of greasy with it, like that's, or like get super dry and they want something like a little richer, that's going to kind of like melt in your fingertips, like that's a really good one. Scar treatment, there's a lot of different ways we treat scars, guys. So if they're bumped up, we can inject them with steroids. So that's going to be like a wonderful way to kind of get those improved. If they're red, we treat them with lasers most often. So you can treat them with lasers, and that would be a good way to kind of improve them as well. There's many different ways that we treat scars. You know, if they're just flat white scars, that's a hard thing because there's not a lot you can do with those. So flat white scars is pretty tough to do anything with. So the doctors are denying it. I didn't see exactly what the different 3 days a week. Is that enough? Really? That's the like the bare minimum. You definitely ideally would want to be doing it more frequently. You know, I would definitely try to be doing it more frequently. So you don't want to, you know, like, because if you're only doing it 3 days a week, you know, it's like the bare minimum. You know, if you can use it 7 nights a week, that's awesome. Definitely doing it like, you know, like 4 to 5 times a week is the key. So yeah, thank you guys so much. Again, I'm Dr. Dylan Greeney. For those of you guys who don't know who I am, I'm a board certified dermatologist. I'm here to help you get your best skin. So any questions you got, feel free to ask them. Again, if you guys are here, you're some of the first people in the live, so you can just like drop the questions in the chat. You know, I love telling you guys stuff that's effective, affordable for you guys, easy to get. Karen, thanks for all the follows. You see the follows rolling in. I appreciate you guys. Sounds good, Bulong. I see you. We'll have you on here in 20 minutes. That sounds great, man. So inflammatory acne, 40 milligrams a day. I think you were talking about, probably Accutane. A 40 milligram dose is actually going to probably take care of most people. It's just slow going. It's not really the dose of the Accutane per day that makes a big difference. It's more of the long-term treatment that it just takes a little bit of time for that to kind of kick in and really work its best. So that's the biggest part of it. So how to naturally clear up upper body acne. There's not necessarily a ton that you can do, like quote unquote naturally, but certainly topical products like benzoyl peroxide and those kind of things are really going to be your best bet. So Medic got me up, very nice of them. There was the burning. What can I use to help with the hormonal acne? So the most effective treatments for hormonal acne are going to be things like spironolactone. So spironolactone is a really helpful treatment for hormonal acne. And you know, if you know, speaking of natural, one natural thing you could try is there's a little bit of like kind of wimpy evidence for so a little bit of wimpy evidence for spearmint tea. So spearmint tea is something you guys can do. So again, thank you guys for hopping on. Great question so far. Keep it up. Spearmint tea. Dark armpits, glycolic isn't working. Yeah, glycolic is just I need ammo. Glycolic is not like perfect. You know, the trouble is with the dark armpits, it is the thickened skin that's causing the darkness. So it's not a bad idea. I do like it. There's a company called Topicals. They make a product called Faded. For those of you guys asking about hair loss, so my favorite go-to for hair loss that I use for the vast majority of people is going to be oral minoxidil. That's the same thing that's in Rogaine, but you can actually take it as a pill. Now, finasteride is another great thing, especially for men. However, some people, you know, have the worries of, you know, it affecting your sexual side, your sexual health, or your sex drive and things like that. So it doesn't happen to most people, and most of the people that does happen in, it's people with a prior history of anxiety and depression. So you know, but there's a decent amount of stuff to talk to about it. Does HCG cause acne while taking TRT? So I'm personally on HCG and TRT myself, and I haven't had any trouble with that, but I will, and my testosterone levels are quite high. I mean, I'm commonly between, you know, 1,000 and 1,200, and I don't really break out, but there's some people that are very sensitive to it, and they're going to have a lot of they'll have a lot of acne, you know, so it can happen. So why does my skin get dry no matter what I use to wash my face? So, you know, you could just naturally have a drier skin type in general. So that could be just the nature of it. And anytime you wash your face, I mean, you are removing some of the skin oils. You know, obviously some cleansers can be more stripping than others. Spirolactone versus Accutane for effectiveness. So the Accutane is going to be way more effective for the vast majority of acne. However, that hormonal acne happens along the jawline, that kind of thing. That's where spironolactone is a game changer. Guys really can't take spironolactone, but women certainly can. So that's another big difference between the two. Women can be on both spironolactone and Accutane. Hyperpigmentation, again, your best bet for hyperpigmentation, which is dark spots on the skin, is one, you know, make sure to stop whatever is causing the trouble in the beginning, right? So you want to stop whatever's, you know, happening in the beginning. You know, And then again, remedy for dark spots is going to be your best thing. So sophomore with dry sensitive skin, do you recommend? So I just like CeraVe moisturizing lotion. Vanacream is another great moisturizer too for the face as well. Best RX for hormonal acne, spironolactone. So spironolactone is going to be your best option for that. So yeah, great questions, guys. So best treatments for pitted acne scarring. So acne scarring is very tough. Usually it's going to take multiple things. Subcision, which is kind of like freeing up the tissue underneath the skin. I do like estheticians. I think we make a wonderful team. I think as long as everybody kind of stays in their lane and works together, I think it's a wonderful thing. I get a little leery of people kind of like, there's definitely a way to like overstep boundaries, I think, which I think everyone realizes, right? Spironolactone can be stopped cold turkey for sure. Scalp psoriasis, I like biologics. We do a lot of topical steroids. I even like some of the like ketoconazole shampoos like that. Anything on Accutane, really you don't need much while you're on Accutane outside of oh, this is going to be a mess here, boys, ladies, boys, everybody. This is going to be a mess. So let's see here. Can we do this? This has to be painted for me to actually hit it. So destroyed some equipment, but still hit me or no? Well, didn't mean to go down that quick. So best treatment for hand eczema, you want to use great moisturizer. So, you know, like at nighttime, like a thick, rich moisture, like an occlusion, right? So like a Vaseline, Aquaphor, Eucerin, or thicker, richer moisturizers. I really like La Roche-Posay Triple Repair Moisturizer. Injectable GHK CU, I don't know a ton about it, honestly. I haven't really used it in any of my patients. So hard for me to say on that, like how effective that is. It's super trendy right now. Everyone's asking me about it on social. But, you know, a lot of people that, you know, obviously prescribe and do peptides for people, they love it. Clarithromycin for acne, not necessarily my top, not necessarily the top choice of antibiotic for people. I usually use a lot of doxycycline, topical clindamycin. These are some of my top ones I do. Man. So best aging skin, sun damage, and wrinkles. So you want to use, like, this is basically a question about, like, you know, what skincare routine should you be doing? And overall, the number one thing that I think everybody should be doing, how did I miss that? The number one thing that everybody should be doing is going to be a good vitamin C in the morning. You definitely want to do a good vitamin C in the morning. And then after that, you want to probably do a moisturizer if you need it. Great sunscreen, at least SPF 30 to 50. So you're going to want to do that. And then at bedtime, you're going to want to use a retinoid or retinol of some sort, and usually a moisturizer. That's going to be your best thing. Now, if you do already have dark spots, you know you have problems, then lasers are going to be the big game changer for you. If you can give a little downtime for lasers, that's really going to make the biggest difference for you. So lasers like BBL, IPL, DermaV, these are going to help with brown and red on the skin and kind of remove it in a single treatment. Literally can reverse years and years of sun damage in just like one go. So it's incredible in that way. Like, I don't know how accurate this is. Need people to, like, paint this. They got me now, dude. Good retinol for sensitive skin. That's an excellent question, because again, everybody should really be using a retinol if you're struggling with your skin. Actually, anybody should really be doing it. But like the best retinol, there's two I'll give you. One of them is going to be Brandify, BRANDEFY. That's really good. And then another one would be like one you can find at the drugstore. It's called ROC, ROC. And ROC was the company that like really stabilized retinol originally, and it's incredibly gentle. They've literally done studies with hundreds of people, and they've done studies with hundreds of people. No irritation. So that's the really nice part about it. So there's not a cure for seborrheic dermatitis, but I like rotating a couple things. I would rotate 2 shampoos. One of them I would do is called Vichy Durcos. So Vichy Durkos, and the other one I do, there's one called Remedy for Dandruff. And if you do those two things, you're going to be in good shape with your dandruff. I would go with those two things. So that would be definitely the way to go. How long does it take to isotretinoin see results? A lot of times you get 3-4 months into it and you're really noticing a big difference. So huge difference at that point. So I hate that I have to do this, but I have to tab out. Let's see. Let's see. Here we go. If you prescribe tret or retinol, how do you start it? So yeah, for the people, Battlefield 6 definitely worth it, by the way. If you're starting like a retinol or retinoid, what you want to do is you want to use only a pea-sized amount. So just a pea-sized amount, and you want to increase it to nightly as tolerated. So like start like just, you know, clean skin at night, pea-sized amount on your face. Start it like every other night, every couple nights, and increase it to nightly as tolerated. Again, thank you guys for tapping the screen, guys. Almost 10K taps. Like with all of you guys here, if you guys tap the screen and run those taps up, we'll be at 10K taps in no time. That literally makes or breaks these streams. Is the best way you can help me. I hope you guys love this, because I love doing lives with you guys. So thank you guys so much for being here, and thank you guys for tapping the screen and fueling the live up. That was close. That was very close. So can psoriasis, dry skin, again, for the winter, I really like La Roche-Posay Triple Repair Moisturizer is a very good one. And another thing that I like is CeraVe Moisturizing Lotion. Both of these are very, very good options in general. Ooh, need to look up. Do you recommend Accutane? I absolutely love Accutane. Like Accutane is one of the best things that you can do like for acne, and the only thing that cure acne permanently. Alistair, thanks so much for being here. It's good to see you too. So thank you guys so much. I appreciate all you guys for being here. A lot of people are in Accutane. How many people are in Accutane? Drop in the chat. If you're on the Accutane, drop the turtles in the chat. What's your morning and night routine? So I currently do, I basically wash my skin every morning. I'm using like La Roche-Posay Tolerian foaming facial cleanser. So I use this. And then I'm using a vitamin C serum. Now, you want to ideally, I would be using like an L-ascorbic acid, like 15%. So I use that right now. I'm personally using like a Drunk Elephant one, but I really love like Brandify. Brandify is a very good one. So you can do that. And then I've been lately using either the Kiehl's like SPF 30 sunscreen or Supergoop Glow Screen. And that's my whole morning routine. I don't really do a moisturizer right now. So I don't really use a moisturizer right now. That's my morning routine. So that's a good question. Again, I appreciate you guys being here. Thank you so much. Inflammation around the nose. I mean, I don't know if you're having some trouble with kind of like the dry, flaky skin around the nose. You can kind of think of that as like dandruff of the face. These tanks are crazy. It's called seborrheic dermatitis, and you can use like ketoconazole shampoo as a face wash. For the person that asked about Vanicream, I love it, by the way. So I love that. I'm feeling great. I saw someone ask how I'm doing. I'm doing real good. So thank you guys so much for being here. Thanks to the medics on this battlefield that are getting me up. So let's see. So can psoriasis affect the teeth and gums? It can affect the tongue, but not the teeth and gums. So there's really nothing that psoriasis has any type of like correlation with teeth and gums, but it does affect the tongue. And you can get something called geographic tongue with psoriasis. So, yep. So it's all good questions. So on Accutane, should I still be having acne? You definitely usually have acne all the way through, like maybe you get to the last month or two of your acne, and then that'll usually be kind of like when it's slowing down. And then ideally you want to be in a position where your acne is gone. So you want a month or two of pretty much clear skin, and then plus having your goal dose met to have the best chance of like remission for your acne. So it's a good question. So bright. Clindamycin and tretinoin, I think someone asked, and that is a great like combo. Man, can't do nothing tonight. Yeah, you want to use like clindamycin and retinol together. I mean, retinol, can any derm do laser for scar? There's some derms that are definitely like way more like interested There's some derms that are like way more interested in the cosmetic aspect of it. You just like anything, like there's people like doing some things and people don't like doing some things. Like you have, you know, maybe dentists that only do certain things, and you have, you know, people that focus on hair loss only, or people that focus on, you know, various different aspects of their specialties. So not everyone has the lasers, not everybody enjoys doing the lasers, but certainly if you look up a cosmetic dermatologist and they you know, they advertise themselves as a cosmetic dermatologist, in that case you're definitely going to be in good shape. They're going to have great lasers, they're going to be able to help you. So what's your nighttime skincare? So my nighttime skincare right now is I'm rotating two things. I'm rotating tretinoin, which is, you know, basically you can think of essentially as your retinol. So if you want some over the counter, you can get adapalene from La Roche-Posay. If you got a prescription tretinoin, stick with that. I rotate that at night after cleansing. I'm cleansing right now with what am I cleansing with the most? I really, like last night I cleansed with the Youth to the People cleanser, and then I put a small bit of tretinoin on, and the next night I cleanse, and then I put on a glycolic, so a glycolic acid. So that's what I'm doing lately. So that's what I'm doing at the moment, and then I do a moisturizer on top. I'm actually using the Remedy moisturizer right now, and I absolutely love it. So I love that so much. So that's what I'm doing at the moment. So that's been my routine. I've kind of, you know, sometimes I get bad about it. Like all of us are human, right? So, uh-oh, they're spawning here. I'm screwed. Yep. So, yeah. So let's see here. Discoloration under your eyes. I didn't see what exactly gave you the discoloration. Do I wear sunscreen even when inside? You want to make it a routine to definitely like apply it every morning. So you don't want to think about it like, hey, I'm out in the sun, so now I'm going to wear it. You want it to be part of your normal habits, because so much of our skin's aging and also cancer formation is caused from like this incidental, like cumulative sun exposure that you get over time. So you want to, you know, so you do want to be like, just get in a habit of doing it. Now, if I go out for coffee at lunch, right? So I'm take a break from seeing patients and I go out for coffee for lunch, I'm going to reapply it. But sometimes, you know, I'm thinking about it more because I've just had a chemical peel or I've just had a procedure. And obviously I want to protect that, but really you should be doing that all the time. So kind of hot here. Just got a tank here to help us. Up top there, I see something flashing up there. A tank on their side. Ooh, ooh. Medic. Yeah, creams versus ointments. Like pretty much when I prescribe anything, I'm almost always prescribing like ointments for people. So I'm almost always prescribing ointments for people. Just because it penetrates the skin a little bit better. And God dang. It penetrates the skin better, and it just kind of, it's like usually more soothing. So for people that have like inflammatory, you know, disorders of the skin or rashes and stuff like that, not only does it penetrate the skin better, but it also just is a little bit soothing for them. However, I always ask the people like, hey, can you tolerate greasy? Because if you don't like greasy and you can't handle it, then, you know, of course, if that's the case, then we're not gonna, you know, like I'm gonna give them a cream because that's gonna rub in a little bit better. Some people are like very worried about getting it on their skin or getting on their clothes and it's being sticky or feeling hot. But yep, it will, isotretinoin will work for steroid induced acne, but of course if you're still on like this real high dose test or something like that, you're still gonna break out. So it's not like a permanent fix, but when you do reduce some of that oiliness, man, come on, I'm gotta get with it. How much school does the job require? So the job requires 12 years of school, 4 years of undergrad and 4 years of medical school and 4 years of residency. So it's quite the long journey. What I recommend for eczema, I really like La Roche-Posay Triple Repair Moisturizer. This is brutal out here. Triple Repair Moisturizer, I'm a big fan of that. CeraVe Moisturizing Cream that's in the jar, very good as well. You got to soak and seal, so you want to be make sure you're applying your moisturizers after you're bathing. You know, lock in some of that moisture on the skin. That's a real key way to do it. So definitely, that's some good ways of doing it. So yeah, and $500,000 in debt. Yeah, I went about $220,000 in debt personally. Fortunately, you know, for those of you guys that have been around, I paid off my student loans about 6 months ago or so. So that was a big goal. You know, I was like very happy to get that. Nick, thanks for the follow. Thank you guys for all the follows. You guys are awesome. 14,000 taps. Where'd he go? Oh, come on. I thought I had him. Yeah. Thank you guys so much. You know, we're at 14K taps right now. I think if you guys, we got such a good crew here right now and so many good questions. Like if you guys tap that screen and run those taps all the way to the top, you get that confetti when it hits the top. And we can get to 20K taps in no time, guys. I appreciate you guys. This is an awesome live. I'm hanging out with you guys. I'm answering your skincare questions. If you guys love it, if this is helping you, tap the screen. It's the best way you can help me. I ain't asking for no money or nothing like that. I just want a few of those taps just so TikTok knows we're helping everybody. That's the goal. So go down. You went back up the rope, maybe. Rope over here, yeah. So yeah, good questions, guys. Thank you guys again for being here. Appreciate all of you. So 30-year-old breaking out regularly, chin beard area. That's not, you know, if you're 30, it's not really going to be like your typical hormonal acne. That's definitely going to be learning to have like a women, adult woman kind of problem more than anything. So it's probably not that. But what you want to do is a good skincare routine, right? Because almost anybody can benefit from a good skincare routine in general. So I would definitely just kind of look at, you know, getting on a 4 or 5% benzoyl peroxide wash. And that would be the way I'd go with it. I would get on a good 4 or 5% benzoyl peroxide wash. And then I would be also using like adapalene at bedtime. That's going to be the key with it. So you definitely want to do that. Red papules cover his shoulders and arms. Can't get rid of them for years. So it could be acne, you know, there's other things. Obviously you could have other reasons for rashes and bumps on the shoulders, but definitely upper back. I mean, shoulders, the most common thing's going to happen. There's going to be acne, and any acne on the chest back can be a little bit more stubborn than the face actually. Transparent skin. So you got that alabaster skin, that you definitely want to protect it. You're going to want to lean in the higher SPFs, 50, sun protective clothing. If you guys are outside, you know, I think that's the key. You know, make sure you're wearing the good sun protective clothing. That's gonna be the best way. Vitiligo, there's not much you can do as far as like over the counter treatments, right? You're not gonna be able to like really treat it with anything over the counter. You're gonna need to get prescription treatments for that. So it's not like you're gonna be able to kind of like treat it on your own from like at home, you know. So we use like phototherapy, so like sunlight, UV, narrowband UVB light. We use that. Keratosis pilaris, what ways can you treat that? Again, I like ammonium lactate and ammonium lactate, and I also like CeraVe SA lotion. So these are good options. Those are like some of the best ones to do. How do you get rid of chemical burn in the eye? I've had it for 3 weeks. So you want to just be very gentle. You want to use just Vaseline, I would say, is going to be your best bet. So just Vaseline is going to be like your best bet with that. Ooh. I threw a grenade. They threw a grenade. GHKCU, not something. Super good game from Logan. Thank you so much, Logan. I appreciate you. Thank you. Thank you. Definitely appreciate you, Logan. Try to wrap. There's a tank over here. Wrap this way. Maybe I can get my boy. So, yeah, GHKCU. I'm not sure about that. So yeah, I appreciate the super good game. Thank you guys for the gifts. I appreciate it. You guys are awesome, man. Such good people in the chat tonight. Appreciate you guys. Well, scary. Why do natural deodorant give me horrible rashes? The problem is a lot of the like natural deodorants are going to be basically fragrance, right? I mean, there are some that do alter the pH, kind of like the Old Spice stuff, like it alters the pH, and that's the way it works. But most deodorants are simply fragrance that's going to mask odor. So it's not like it's just masking the odor. So you probably have a fragrance allergy, if anything. Pretty low on ammo here. Yeah, that's the trouble. Aluminum block help control acne. I don't know. I'm not aware that there's really any good evidence for nope. I am not aware that there's any good evidence for aluminum blocks helping with that. I mean, obviously I've used it as a styptic pencil to kind of help with shaving and those kind of things. If you get a little nick or cut or something like that, but I've never used it really for acne in general. So I don't think that's really a good plan. This is like really intense here. What am I doing here? What am I doing here? Help me, help me. I'm scared, I'm scared. I'm scared, I'm scared. Everything's on fire. Oh my gosh. Removal of skin tags. So skin tags in general, best way is one, make sure you stay active, eat healthy. Just because a lot of times metabolic disturbances like getting like elevated blood sugar levels and insulin levels, insulin's a growth factor, so it's going to make a lot of these bumps kind of appear and pop up more frequently. So you definitely want to make sure, like, you know, you're doing a good job with that. And then most of the time just snipping those away is really going to be a great way to like just snipping those away with your dermatologist. Not something you're going to want to do, like not something you're going to do on your own, but see your dermatologist and just paying a small fee, you know, to get those snipped away. That's really the way to go. So dry skin fix, a little bit of like fish oil can potentially help. That's one thing. And so a little bit of fish oil can potentially help. And you want to use a rich moisturizer, right? That's loaded with ceramides. So again, like something like CeraVe, La Roche-Posay, these kind of things are going to be your like best bet. Contact dermatitis. So tacrolimus and hydrocortisone are great options, but obviously with any kind of like contact allergen, the biggest thing is avoiding the allergen. So if you realize what you're allergic to, you just want to make sure to avoid that. That's going to be like the #1 treatment for it. So that's going to be the biggest thing. So clearing psoriasis on the scalp, again, biologics are going to be like your best option for that. They do the best job of like getting rid of things. Yeah, biologics, those are injectable things you get prescription. Korean skincare work. I mean, you know, I'm not like the believer like, oh, like Korean skincare is like by far like the best thing, or it's like, you know, it's the most unique thing, or, you know, like that's what you need to do. There's good products from everything, right? You can find good products from almost any brand or region of the world, you know? You guys hear him? Is it bad to pop my pimples? So one of the most common reason that people do get scars is because of manipulating their acne lesions. So it's definitely something you want to be careful with. Pimple patches. Yeah, pimple patches are good. Peptide injections. So I don't personally prescribe them. You know, I think there's not a way to really fix transparent skin. Some people are just lighter skin tones in general, and that's just normal and natural. You just have to be good about protecting your skin. Thank you guys so much for tapping the screen, guys. 22k likes is crazy. Thank you guys so much. Missed you on live. Hope you're I'm gonna hang out for a while, so if you guys are here and want to hang out, feel free. Finasteride is one of the most proven ingredients for hair loss, so I strongly believe in finasteride. A lot of times I use it in combination with oral minoxidil to get the best hair. Scar on the chin just depends on the type. Ouch. Wow, look at that helicopter all the way up there. Got me. That's crazy. Got me bad, man. That's an interesting strategy, just hanging up way high. So yeah, the scar on the chin, it depends. You know, you obviously can do you can definitely do You can do, you know, if it's red, you can treat it with laser. If it's bumpy, you can inject it with steroids. If it's flat, you could do things like, you know, or dimpled in. You do things like subcision, or even fillers or biostimulators under it. Different things you can do in that way. So a lot of different stuff you can do for scars. That was an enemy there? Yep, it was. There he goes. Best way to get rid of HS dark spots. I would probably try topicals faded, but you know, it's tough because, you know, as you get more HS lesions, obviously you get more dark spots. So you got to get the HS under good control the best you can. It's never going to be perfect necessarily, but that's one thing you want to do. And then I would probably use like topicals faded. That would be like a really good plan. You know, I'd use that. So we kind of go with something along that way. Thank you guys again. Eczema on the face. Just gentle skincare. I love Vanicream. Another really good like gentle brand that I like is Avene, Avene. They're a really nice gentle brand, so you can find some good options from them as well. So I would check out those brands. Best non-fragrant shampoo for the hair. So if you're looking for super duper gentle, I mean, like you could either go like the CeraVe gentle shampoo. So they, you know, if I don't know if I have one within reach here, I was going to show you guys, but CeraVe got into hair care like this year, and they have like great non-fragrance shampoos. That's a really good option for you. So I'd check that out. I would check that out. Or, you know, you can get Vanicream shampoo. I mean, it's super boring, but worth looking into, you know, but sometimes boring is best, you know. Logan, thanks for the dino, man. Thank you for the dinosaur. I appreciate it. I appreciate it. There's one right behind me. Can they come in here? It's like right next to me. He's in this one over here. See him? Oh. So, let's see. How to treat cystic acne. There's really only one way, and it's Accutane. So Accutane's really the main way. There's no like perfect. I don't really mess with ladders much. I'll try these out. Can you go up here? No, not really. So, woo, woo. What's your opinion on Tremfya for psoriasis? It's a wonderful treatment. It's such a good treatment. I highly recommend it. If you have the opportunity, you know, to get on something like that, it works wonders. Dermatofibromas, I didn't see the full question, but you know, it's a common type of skincare or skin lesion that, you know, is a little bit more common in women on the legs, but you can get them honestly anywhere, and guys and women can both get them. So, hey, boo, is that you? Okay, heard you breathing. I don't know. Talk real quick, boo. I just want to see if it's coming. If you're coming through on the mic.
Oh, is that okay?
Yes. Yeah, I think it is working. So, yeah, we got Boo Long here as well, guys. So I think he's probably gonna hop in too. So, how do you fix inflammatory acne? Again, if you guys are looking for the great acne routine, I would use like a 4 or 5% benzoyl peroxide cleanser in the morning. Not a dermatologist. Thank you so much. We'll see you over on the other platform. Thanks. Panoxyl, love it. They make the full spectrum. They make a 5% benzoyl peroxide. They make a 10%. For the face, just 4 or 5% is fine. For the body, you do want to lean towards that 10%. So, oh dang, there he was right in front of me. Surprised he ran. Why did he run? He had me, man. So that was PUBG, bro. Let's see, clobetasol or betamethasone. I'm team clobetasol for most things, but both are great. They're obviously both super potent topical steroids, so I use them both so much. But I love clobetasol. That's like my main go-to. Is Based Bodyworks good? I've never really used that personally, so don't know if I have a strong preference on it one way or another. Genetic eye bags. If you have eye bags and they're bad, I mean, the best thing to spend money on is going to be like a blepharoplasty surgery. You can do a little bit of lasers. Like I do all kinds of lasers and stuff for the eyes, and sometimes it can make a big difference. My skincare routine right now, I'm doing like I'm using a in the morning, I wash my face with La Roche-Posay Tolerian foaming facial cleanser, and then I'm using Drunk Elephant vitamin C. But another great vitamin C is like Brandify vitamin C. And then I've been rotating between either Kiehl sunscreen in the morning, which is non-tinted, or I'm using Super Goop Glow Screen. I love that one, so that's what I've been doing the most. No way to. I have nothing to hit that with. Yeah. So, what other question you guys have? Dupixent's a miracle. I totally agree. And I really appreciate you guys like helping each other in the chat. I mean, I think it's so helpful. There's obviously a lot of people that got a lot of skincare knowledge that hang out on my channels. And there's so many people that know a ton about, about it. So I appreciate you guys being here and sharing your knowledge with others. Victory is imminent. Got one there. So GHKCU, yeah, I mean, lots of peptide questions. I really don't do them and know about it a ton, to be honest. What's the treatment for dermatofibromas? You usually most of the time just monitor them, leave them alone. But you can cut them out. It's going to leave a scar about the same size as the bump that they removed, though. So, it's not like you're going to get rid of it and it's going to be like perfectly clear skin or anything like that. But overall, it can be a really, if it's bugging you, some of them times they do get tender. And if they are tender or painful, then it's probably worth maybe like removing them. So. Having a biopsy on the chin. Yeah, it's tough. I see you're a lady, and obviously like we never want to leave a scar on like a young lady's face. I mean, but if it's suspicious, and you're worried about it being a skin cancer, sometimes you got to do it, Tell me about HS. So I actually just did a video on HS the other day, but HS is hidradenitis suppurativa. It's kind of an inflammatory condition of hair follicles. And, it happens a lot of times in intertriginous areas like under the armpits and the groin. But severe cases can happen anywhere in the body. Variety of treatments, topical antibiotics, topical washes that are antimicrobial. And then sometimes nowadays we'll either do also biologics or surgeries. There's other oral treatments that are hormonal or anti-diabetics that you can be used for it too. So a lot of different options for HS, but it's a very frustrating condition, no doubt about it. So you want me to just back, Wheeler?
No, just keep going.
I mean, this is done. This one's done. If you want in.
No.
Okay.
I'm already in.
You're in with, well, get my party, right?
Join your party as soon as we load into another one.
Oh, okay.
You don't have to back.
I mean, I'm out.
Oh,
Yeah, but I mean, it's all good either way. If you're rolling separate or something, like, don't worry about it. How do they test for lichen sclerosis? Best treatment. So Ash, thanks for being here, by the way. Ash, just shout out to Ash. She's like top 3 viewer for the night. So thank you for being here this whole time. So most of the time you can kind of tell clinically, right? Usually going to get like scarring, atrophic, like looking skin. But you can biopsy for it, and that's going to tell you for sure. You can have like a lot of like genital lichen sclerosis, but obviously you can also get it like extragenital and like areas on other parts of your body too. It just depends. Like the main treatment that we do for that is going to be like super potent topical steroids, even when it's in the groin, which sounds like kind of crazy, but that's usually how we'll do it. If it's a bad case and you're having a lot of trouble everywhere, then we might do something more like oral methotrexate, which is types of pills that you take once a week. So it just kind of depends though. There's a lot of different ways, you know, you can treat it. But it's a frustrating condition too. It's not an easy one by any means. So yeah, silicone strips, like, you know, certainly once your stitches are out, you know, or dissolved, if they use dissolvings on the top, I would start silicone gel sheets personally. If you need to, you could always start like, you know, you could start like 6 weeks later. Are Bulong, are all the dogs rolling? Is that what's up?
It's just us.
Just me and you.
They're all, yeah.
Okay.
Still.
So yeah. Hey loves. Hey, let's see. We got a nail review. The wife just came up. We got our baby shower tomorrow. So love you, run live here. So here, that's the camera there. Oh. So let's get a view. You got to get close and hold it and let me hide my face because it want to focus on your. So back it up a little bit. There's the nails. What do you guys think? Rate the nails 0 to 10. 0 to teal. 0 to 10. The plan
so
tomorrow.
Beautiful.
So pretty, 0 to 10, and then tomorrow 10 out of 10, 10 out of 10. But here's the, you guys don't even know the theme. The theme is
sweet as can be.
Sweet as can be, and that is the sweet baby shower tomorrow for Vivian. So show them the nails one more time. Got 10. We're getting a lot of 10s, 9.5s. Sweet as can be. Let me hide my face there. There it is. What do you think?
Oh, there's better.
It's good. That's what we're working with here. Love the bees. So sweet as can be. So yes, love you. Thanks for coming to show me love. Let's see. So all right, Boo, are we getting in with me or no?
Mojo is in your party.
Oh, okay. Let's see here.
So good. Next time I do it for you.
Well, there you
free.
Go. Bulong can do it. Let's do breakthrough. All right, my dark spots are really deep. The glycolic for 6 months and not working. Yeah, Lily Ray. I mean, sometimes honestly, especially if you got fair skin, just go get laser done. Like, go to the dermatologist, get laser done. You can put a lot of dark spots to rest. The only one I do caution you about is if your dark spots are caused from melasma. You want to be careful with that because the melasma related dark spots, that's a whole different beast. So the melasma related dark spots is a whole different beast. So what options for Sebderm on face if keto cream doesn't work? So adding in a little bit of steroid can help. There's actually new treatments too called like Zareve. Zareve can be helpful. Sarecycline 100 and Spironolactone 50 not getting better. So the question about that though is like literally how long you've been using it. You know, I want to be a PA in working in dermatology. Any thoughts? So it's a competitive specialty. Obviously, dermatology as a doctor is far more competitive to get into that. But a lot of PAs that do get into that space, they stick with a job. So maybe there's not like a ton of like openings like real quickly. So that's the thing, guys. The live, you know, it took a little bit of a dip. It took a little bit of a dip, guys. I need you guys right now. If this is helping you guys, I need you to tap the screen. For the 175 of you guys are here, tap that screen. Run the taps all the way up. Drop like 100 taps. That really, really helps fuel up the live. And it helps like kind of keep this thing going. Because I want a lot of questions to keep coming. You know, even if if you don't ask the questions, like you're going to learn a ton by just hanging out here. So some people are a little too nervous, you know, like to ask the questions. So hang out. Ask the questions you guys want to. We're creeping up here. We're creeping up here. Oh! I tap when I'm not helping my 3-week-old. Oh, congratulations. I didn't know you had the baby. Congrats. That's awesome. Congrats. I'm so happy for you. And definitely that 3-week-old got to take some priority for sure, right? Sweet baby. So we're in here. We're gonna hang out here. We're gonna cap this.
Slithering up.
Folliculitis besides antibiotics, you could do like one of the things I love so much is actually I really do love my cover just went down. I really like CLN. So CLN body wash is a really good option. Need some ammo. I don't know what you're rolling with.
Support.
Can I get some ammo where I'm at?
and get to you.
Well, they're close. Yeah, this is hot here. So, Andre, thanks for sharing the live. Appreciate you guys. I'm on the last 14 rounds, bro.
You're on the other side.
I'm dead. Should I use CeraVe? Yeah, CeraVe is a great brand overall. I love CeraVe. It's a really good brand in general. CeraVe's great. La Roche-Posay is great. There's a brand called, it's a way underrated brand called Brandify, and it is absolutely awesome. So, highly recommend people like try out Brandify. Why am I getting hurt here? Team Cetaphil checking in. Nice. So, yes, Cetaphil is a good one too. I mean, it's funny. Some people like try to like, say, Cetaphil versus CeraVe, that kind of thing. I'm just a big CeraVe person in general. Both are great though. Is this the enemy right here? Yep. Oh. What should I use for Keratosis pilaris? I would use amlactin and CeraVe SA lotion. Kind of rotate those things. That would be good. Microneedling at home. I like it. I like stamping microneedling more than rolling, and I like Cure micro infusion system, and I also like Vanish 3.0. Those are really, really good options in general. So thanks so much. You like the giant CeraVe? Yeah, I got that one. I got a little La Roche-Posay there too, like right there. So I have a little bit of both. Curious to what our people are doing. We're the only people like on front of the point trying to push it.
But there's two snipers in the window in the far back that eyes on me.
What, do we need a flank or something? Or? Switching from stun to kill, bro.
Get me, back to you.
Oh, yep, we got you. Good call out. Is it painful to remove a skin tag? No. Sometimes actually people don't even numb them; they just snip them off because sometimes the numbing like burns a little bit more than the snip does. The snip's obviously just like a very quick pain. So one of this. Oh. Yeah. Thoughts on topical copper peptides products I'm using now. We've talked about it a few times tonight, but La Roche-Posay Tolerian Foaming Facial Cleanser, Drunk Elephant Vitamin C, Super Goop Glow Screen I'm using. So a few things. La Roche-Posay better than CeraVe. They're both great, honestly. Either of these brands have like really great products. Like they've each got good.
Far left,
yeah. Come back and switch out a single here. Oh, taking some shots there. You down? I got you. Oh. Collagen supplements, they help wound healing and stuff, but they're not like they help wound healing, but it's not like they know to like go into your skin for like anti-aging purposes or anything. So it's not like it's not perfect, right? Thoughts on how to get rid of eczema. So there's no perfect way to get rid of eczema, but woo. Bless me. Thank you.
Yes.
So there's not a perfect way to get rid of eczema, but what you can do is you soak and seal and that kind of thing. That's going to be a way to lock some hydration in your skin, because that's about the best way to help to reduce eczema flares. But a lot of times you have to treat it with prescription treatments in general. Thanks for trying. I saw you, Bulo.
Hello.
And then we're streaming, just so you know, brother.
I had my girlfriend suffers from eczema.
Oh, for eczema? She has eczema?
Oh yeah, her entire life.
Oh man. Yeah, it's frustrating for sure. And then like obviously fairly genetic, it's like if mom and dad had it, there's a good chance that daughter's gonna have it. Definitely a frustrating condition in general, and there's nothing that's necessarily a cure for it. A lot of people do grow out of it more with time, or it gets less, it gets a little bit more mild, but you know, it's not always perfect either.
Yeah, Hitrig is our dairy,
Yep.
and we recently discovered certain kinds of collagen also trigger.
Oh, really? That's, yeah, you don't hear that too often, but definitely food allergies are, you know, definitely more common in the eczema population, you know, so see a lot more like food allergies and that kind of thing. Getting rid of rosacea. So main thing you're going to do with that is going to be, so main thing you're going to do with that is going to be lasers to reduce redness. The bumps of rosacea can be reduced with azelaic acid, which you can get over the counter. You can do a couple little hacks and tricks with like medicines like oxymetolazine, which is so oxymetolazine is oh man, is like what's in Afrin, and it tightens up blood vessels, right? So that's a good way to do it. So you can do that. My face is red around the mouth and cheeks. How to get rid of it? So if you're dealing with just straight redness, your best treatment for that is going to be laser. I personally use DermaV, but you can use PDL, BBL, different treatments like that. Hypochlorous acid, great for a pinch. You know, it's not, you know, it's relatively recently hyped, but what's our plan here, Bulong?
We have them.
You don't have
Oh,
one?
you guys are playing Battlefield,
Yeah,
aren't you?
yeah. BBL, so BBL, there's two different types, right? There's Brazilian butt lift. When I say BBL, I'm talking about broadband light. So broadband light, that's a different type. So, and it's not a laser, it's a type of light-based device. And it can reduce, you know, it can reduce redness and brown in the skin. Use it for all over facial rejuvenation. It's a little bit, it's not a great option for people with darker skin tones. So you do have to be a little careful on that front. You want to make sure you're going to an expert that's like comfortable in using it. Seborrheic dermatitis, when keto doesn't work. So it is pretty tough. You know, seborrheic dermatitis is usually not something that's oftentimes cured. It's kind of treated. So is Nair safe to use on the face? They do make sensitive versions of Nair, and the biggest things I tell people is if you're going to use it, you have to definitely follow the instructions. Do the testing the way that they describe to do it, because do the testing the way they describe to use it, because it's very easy to get a chemical burn if you're not careful with it. So best sunscreen without a white cast, there's so many. I probably like one of my top favorite ones of all time is going to be like LTMD. So I love LTMD UV clear. I love tinted sunscreens the most. I love tinted sunscreens, but you know, there's a lot of good options in general. So that one, I love Supergoop. La Roche-Posay makes some really good ones as well. I love tinted sunscreens. Yeah, Ash, absolutely. Tinted sunscreens are like the way. You just got to find a tint that works for your skin is the only thing, you know. So are we going to cap this, you think, or not really?
For
So the windows to the right too. You probably know that, but trying to push. Rough. Trying to lock in. My eyeballs are bleeding, dude. I'm down. I was deep in. When do you say to resort to Accutane? If you've tried like the typical first line therapies and failed them, or if you're having any acne scarring, like if you have acne scarring, like just jump to Accutane, because the last thing you want is to get like, you know, stuck with the acne scars that are like basically impossible to remove completely. Panoxyl is a great acne wash. Again, go like 4 or 5% on the face, but if you're trying to treat body acne, then you'd want to lean into something more like a 10% for the back. A specific shaving routine to avoid pimples and breakouts, like you definitely, you know, you can get ingrowns and that stuff. There's a lot of different ways to do it, you know, like the closer to the skin you shave, the more likely you are to get ingrowns. So, you know, you could shave with the grain instead of against it. Some people go back and forth about using like a single blade razor versus multiple blade razors. You know, there's different ways of doing that. A lot of times just putting like a little bit of a antibiotic on the skin after cleansing, that's something. Red light mask I do recommend. It's the cherry on top, so it's not like the first thing I tell people to get. Top squad. Nope. So we didn't do it, bro. How you liking the 5.56 MK2, bro? Boolong.
It's actually really good.
It's hitting hard.
Yes, it does.
Yeah, it's good. I need to turn on this XP boost, don't I? So yeah, good questions. What do you suggest starting dose for Accutane? I start almost everybody at 40 milligrams a day. That's like my typically start about 40. Retinol or tretinoin? So tretinoin for sure. If you have a prescription for it, the trade-off with that is going to be the tretinoin is going to be more irritating. For the person also that asked about red light mask, like which ones to use, the Shark Beauty one, I have to admit, is very good. Also, Current Body is very good. And then a lot of people have heard of Omnilux. It's very good as well. Cure also makes a great mask. Qure. I saw some hilarious like memes today on TikTok about like this first point and the like intensity of getting hit at this first point. It's like just like, I think it was this map they were talking about. I have a very low threshold.
Is rough.
Yeah, I think so. I have a very low threshold for starting Accutane just because I want my patients to get better and give them the chance to like cure their acne permanently. You know what I mean? Oh. How do I get rid of acne scars? So lasers are going to be like one of your best ways to do it, right? Lasers. There's no one size fits all for acne scars. What do we think about single shot on the ARs?
It's worth it.
Yeah.
You're doing enough damage. Single shot.
I'm kind of feeling it a little bit. Dupixent works miracles. There's only a few types of medicines that I kind of call like miracle drugs. Dupixent being one of them. Accutane is a permanent solution for many people. So there's definitely a lot of people that do get like a permanent permanent solution, yeah, for some people. Now there's a handful of people that need a second course, a very few that I would say that need like 3 courses. I mean, that's kind of crazy. Usually don't need 3 courses, but brighten the under eyes, retinol, you know, eye serums under the eyes is key. I like Brandify. I also like Versed Smooth Landing Retinoid Eye Balm. Those are really good. What do I do? My hands are sweaty. That's called focal hyperhidrosis. And the main go-to in the beginning is you can do things like dry sol, which kind of plugs up your oil glands. There's other types of machines you can use at home called iontophoresis, which is a cool thing. And then outside of that, you can do things like Qbrexza, which are like pads that you put on your pads that you kind of, or it's like a pad you wipe on your skin. And that can help to also reduce, that can also help reduce sweating as well. 50% peel totally depends on like what kind of peel you're doing. Like, you know, if you're talking about TCA versus glycolic versus blah, blah, blah. So there's a lot of different kinds, like many different kinds of peels overall. Milia, the best way to treat that, it's going to be salicylic acid cleanser. And then adapalene or another retinoid at bedtime. Like those are the ways you're going to want to do it. What about baby oil? Baby oil is not like really great for hydration or anything, like, and it's also kind of dangerous because it's so slippery in the bathtub and stuff. So like, you know, we don't really use it a ton for much. It's fairly inert, you know. Obviously you don't want the fragrance stuff. If you were going to use it, I would like avoid the fragrance stuff.
Keeping my joke to myself.
Right, thank you. No, it's hard. Just 2 on the point. What to do about nail fungus? So nail fungus, you almost always are gonna have to treat with like oral antifungals. Terbinafene's the most common one, but some people use itraconazole. I feel like I'm scared to move. Yeah, I knew the tank was gonna get me though.
I'm scared of him.
Yeah. What do you do if Dupixent doesn't work? Thanks, bro. Dang, I'm down again. If Dupixent doesn't work, there's other things, like there's similar things like Audbrey that can be used. You can also do some like what are called JAK inhibitors that definitely have more risk to them, but can also be used as well. Efficlar Duo, do I recommend it? Oh, for sure. Like Efficlar Duo is a wonderful treatment in general. Help for lichen planus. So usually going to be treated with topical steroids. Other treatments too, like Otezla can be used for lichen planus. So especially bad cases, that can be done for those. Tretinoin and wet or dry skin, absolutely dry skin, 100%. I mean, obviously you can wash your face, but you want to use you want to wash your face, but dry it, because if you put it on wet skin, it's going to absorb more readily and it can be more irritating. So you definitely don't want that. Does salicylic acid make skin dry? It does. So salicylic acid is going to be drying on your skin. Most of the time for acne purposes, you're going to use like a 2%. You're going to use a 2%, but there are 0.5% that are out there that you could use if you want something that's going to be more gentle. Like, is this not actually hitting?
What do you do?
I'm in the big machine gun and I'm like, this thing is not even actually hitting. They're up close. Oh, that means flanking me on the right. Can't see anything. Dang. Is it okay to take Accutane? I missed the other part of that. Thoughts on Korean skincare methods? I mean, I think it's fine. Was that you that got knifed down just now? No.
Didn't realize there's a tank right there.
Mm-hmm. Scary. What could treat not sweating? So there's not really anything you're gonna be able to take to make yourself sweat. You know, there's definitely genetic conditions where people don't sweat, but you're prone to overheating and things like that. Beto GA, thanks for the roses, by the way. I appreciate you guys. Thanks for all the taps, guys. 32,000 taps. I know we could get up to 50k taps, guys. If this is helping you, make sure to tap that screen. We're gonna keep answering your skincare questions. So if this is helping you, please tap that screen and we'll make sure to answer your skincare questions. Tips for black guys with razor bumps. Again, the closer you shave, the more likely that it is to get, you know, those ingrowns. Make sure you're maybe using some kind of antimicrobial like wash after the fact, just to reduce inflammatory bacteria on the skin. That's going to be something you definitely can do as well. Make sure you're doing that. You know, if you're able to find someone to like help with laser hair removal, or you could experiment a little bit with other like kinds of depilatory creams like Nair and things like that, that might be a good option for you to try out too. Hormonal acne, kind of best treatment. Yeah, lichen planus. Yeah, it's tough with lichen planus. That's right. I mean, sometimes you need hardcore stuff. Methotrexate, Cellcept. There's different ways to do washes. I use a lot of like clobetasol in the mouth, clobetasol gel, like on a cotton ball. You know, there's different ways of getting at it and doing it. So. What's the reason behind blood-filled pus acne? So acne is always multifactorial. It's going to be like ultimately the, you know, kind of problem one is going to be, you know, blockage of a pore. So pore gets blocked, and when the pore gets blocked, then oil builds up behind the pore, and then bacteria metabolize the skin oils. And then that causes inflammation. So that causes inflammation. And so that's some of the big like issues with it. But in the end of the day, reducing that pore blockage, the bacteria on the skin, maybe a little bit of the oil production, like all of those things kind of help across the board. So. Are you around, Belong? I'll take your revive if you are. Thanks, bro.
I think there's a tank right outside the early gates here.
Oh, I'm down again. Yeah, I'm on snipe right now, so I can't really. Thank you.
Are you lagging?
I've got a latency of 32, so I'm doing okay right now. Oh, they're behind us now directly. Yeah, behind the pearly gates, as you said. How to prevent craters in the face? You just want to get like really good. In general, you want to get you know, really good control of your acne first, right? Because, you know, just treating the acne in general is going to be the main key to kind of helping that. Beef tallow, definitely not about it. Do not recommend. Do not like.
Yeah, I'm getting the ping meters saying I'm lagging.
Really? You can back if you want to.
No, you're good.
Like,
last too.
were you? We can try like doing a different one, you know. Is methotrexate safe to take? It's not one of the safest medicines, but we did use it for many, many years. Like we've used methotrexate when we didn't have better stuff. So it's very cheap and it does work for people. Seborrheic dermatitis, I would rotate Remedy for dandruff, which is a shampoo. And the other thing I would be doing is Remedy for dandruff, and I rotate Vichy Durkos. Those are two wonderful Vichy Durkos and Remedy for dandruff. I'd rotate those two. One's a selenium sulfide. The other is a mix of ketoconazole and salicylic acid. That's very effective. a DMR. Messed me up too. Scary, dude. Scary. Come on. Oh, that's my boy. Can't shoot him. So constant scalp psoriasis to be treated, constant flare up. Biologics are going to be your best bet with that. You know, like the injectable biologics, that's going to be like your number one way to kind of improve your skin, and kind of get as much clearance as you can. Like there's a lot of times that people literally get 100% clear from that. So I was hitting my shots at one point. I remember a time when I was hitting my shots. People are crazy, bro. People diving and... Oh, come on, let me hit something, bro. Reviving people and I'm missing everything, bro. It's getting scary. How do I get rid of PIE? I would go with like either like a niacinamide, like a 4 or 5% niacinamide is a good option. Your best bet though is like lasers. Like lasers are going to be really good for that too. Acne scars do go away. In fact, a third of acne scars are going to improve on their own completely. So a good chunk of them actually do improve very nicely on their own, but sometimes you do need lasers and need other treatments for it. Like, so thoughts on PDRN? I mean, I've used a few PDRN products, but you know, I don't know if you can really still do that technically in the clinic, like the clinical setting in the United States. A lot of these exosomes and like stuff like that. I mean, you see people going to like Seoul, South Korea and everything, like get these kind of things done. Just because I think it's not like as regulated there, you know. The homie's back. Homie's back and I'm cracked. I can't miss. I missed 3 shots already. I did hit 1 though.
No, I can't miss. I missed 3 already.
Yeah, yeah. I mean, I'm hitting, bro. Zari for patients. It's nice to have a steroid-free option for sure. So, I haven't had a ton of people on it though, because I do always try to recommend like products that are generic and cheap for people. I don't want to always like jump to the very expensive new stuff, because a lot of times old stuff can work. A lot of times it's about compliance, you know. How we doing, Boo? Should we back out and see if we get into something different so you can not lag? Here, back out. Let me see if my AR has a better mag on it. So what other question you guys got here? 33k taps, guys. 33k taps. If you guys are here and you love skincare, help me out. What I'm asking you, what I've been doing for you is answer your skincare questions. What I'm asking of you though is tap that like. So what I want you guys to do is run those taps, like just like smash those taps, run them all the way up to 50k. Run it up to 50k. Let's make it happen. Let's check the mags. Can we change this mag out? There are other mags, but they're locked. The highest is a 40. So okay, been trying to get rid of my. Go ahead. What?
What gun are you using?
I've been running the M433.
Switch to the sword. You'll notice a difference.
Really? I mean,
It's so much harder. As long as you tap fire,
yeah,
it's actually a little bit better.
Okay, because my other one's like really kitted though. Like I have it like fully kitted.
Once you start leveling the sword, it won't
matter.
go back.
Okay. All right. We're gonna see about that. Sword. Got it set now. GHKCU, like I don't really know a ton about it. I don't personally like do the prescribing like peptides or anything. So I'm not really sure about that, to be honest. And then, are you ready for it?
Yeah, whatever.
Let's do it. Tret causing dry eye. I've never personally had a patient like actually personally complain of that. Never had a patient personally complain of that, so I'm not about that. Bubble skincare, very cool, fun, fairly affordable. They have good actives in them, honestly. I don't know if I can name off the top of my head like a favorite product that they have, but I think it's nice. I think kids like it, or obviously. Permanent way to get rid of rosacea. You can permanently reduce redness, the bumps of rosacea. Most of the time people are going to grow out of that to a degree, but azelaic acid for the bumps, laser for the redness. Look at this gun, bro. Look at this thing, bro. Here, hop on this with me, bro. You drive us in. Are you driving? Yeah, I'm on. Take us to the candy shop, bro. Oh, you're not driving, are you?
I don't even know where you're at.
Bro, lock in, bro. We're capturing F, bro. Accutane 5 days ago. Congratulations for being on the best treatment that there is for acne, and the only thing that can cure acne permanently. So happy to hear it. Oh man, this thing does have a little rise on it, don't it? Oh, I don't know, bro. This thing ain't hitting, bro.
Get used to it, I'm telling you.
Yeah, it hits. But you run it in full auto, but you tap fire.
Yeah.
Thanks for the follow, guys. I appreciate it. You guys rock. Thank you so much for hopping on again. I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So any questions you got, feel free to drop them in the chat. I'm here for you guys. Come on, baby. Come on, baby. Oh, am I out of ammo already? Holy crap. I guess I got res, that's why. I'm over here by myself too. Any Rex for eczema in children? I love the CeraVe baby eczema line. That's actually what I use for my son. He's 15 months and he's got little eczema on his feet and stuff. And that's what I use. But the biggest thing is just, you know, after you bathe them, make sure you're soaking and sealing them. If they're really bad with eczema, make sure you're treating them. Make sure you're treating them at bedtime as well. Doc, what's the advice to match into derm? Well, stay passionate about it. Always be willing to help. Always be paying attention. Uh-oh, we got an enemy here, boys. Defending. I think they crashed into him. Oh wait, no, it's contested. Dang.
You at B?
I was at F. I was still over at F, but ear keeps splitting open. I've tried tons of eczema. So if you got that ear splitting over the bottom, it usually means that you're super infected, and actually the bacteria is the main problem. So what you want to be doing is use, like, I'm on D with you, is actually use like a like an antimicrobial cleanser like CLN to reduce like that inflammatory bacteria. Because if you have eczema or you have that skin bacteria that's causing that breakdown of your skin, then, you know, if you don't get rid of the bacterial problem, then you're probably not gonna get rid of it. If you get a prescription, you know, something that really helps a lot is going to be something like mupirocin, but you could literally probably just get it under better control with good use of like an antimicrobial cleanser like CLN. So thank you guys for all the follows. You guys rock. Again, I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. We've been on here for an hour and a half or so. We've been helping everybody like with their skincare questions. This is what I do. I've been on TikTok for about 5 years, like helping people. So if you got any questions at all, you know, obviously feel free to ask. Tap the likes. That's the best way to like help support the live stream. So I appreciate you guys. Wow, dude. I don't know, bro. This thing takes a lot of shots, dude.
Scared of it.
Maybe.
You scared of it?
It hits for 20. Have you tried? I haven't used the AK now. Is it good? Thank you guys for the follows again. Appreciate you. Ooh, ooh. Like they're honest, bro. Yeah, they were honest for sure. Dry scalp. Yeah, the best dry scalp shampoo that's out right now. The best dry scalp shampoo that's out right now is Remedy for Dandruff. That's the name of shampoo. Very practical name. So let's see.
Yeah.
Combination skin. So for combo skin, my favorite one is CeraVe cream to foam cleanser. So I like that. Luke, thanks for the follow. I appreciate you guys. Lots to do follows tonight. Lots of new community members. So I appreciate all of you guys for being here. Okay. I'm getting the feel of it.
You're getting them.
A little bit. Trying to get rid of your acne for 7 years. If you've been doing that and you haven't taken Accutane, that's your phase 1, step 1. Do not pass go. Literally get on Accutane. Talk to somebody, get on Accutane. If I use, oh man, I about almost read that. You probably will break out from that. Did you see that question?
No, I did.
Oh, dude, that was close.
Yeah, tank coming.
Yeah, quickly. Sometimes I just read those, you know, just to do it. Tank's coming. Should we just leave here then?
It's on E.
E? Okay.
Tank's on E.
Oh, they're smoking. How's it over there by you? So rosacea bumps you want to treat with azelaic acid. If it's redness or rosacea, you're going to want to treat that with laser. Best shampoo for psoriasis. My general go-to is Nizoral shampoo. It's a 1% ketoconazole shampoo. We taking this, bro? They here?
Somebody, yeah.
Get on it so we can cap this. I love the helicopter that crashed in here. So about to getting rid of the brown spots. So brown spots are easy to tackle with lasers, but if you're wanting to use them over the counter, the best treatment is Remedy for dark spots. That's a product you can get, Remedy for dark spots. But the question was basal cell. So basal cell is the most common type of skin cancer. about 1 in 5 people get it, and it's caused from sun damage. And it doesn't tend to spread or hurt you, but it can get bigger over time, and it can make it that more difficult to remove, of course. So you always want to catch them early and remove them before they get big, because they can be pretty destructive locally to tissue. So that's the worry. Oh, right in front of us. There we go. We got a helicopter flying over us. Nice. Come on now. Got a new follower. Well, thank you guys. I appreciate it. Thank you guys for the follows. I appreciate it. Victory. Victory, victory. Regular color from suntan. So if you're looking to like fade a tan, then obviously you got to get on sunscreen. If you're trying to like prevent tanning in general, great sunscreen use. And then you can use other sun protective supplements like sun powder, which have been shown to reduce sunburn cells and also tanning. So yep. How you holding up, Boo? Boo. Boo. Thank you guys so much again for being here. I'm Dr. Dylan Greeney, board certified dermatologist, here to help you get your best skin. So thank you guys. Thank you guys. Definitely have treated cases of purpura. I mean, there's a lot of different causes of purpura. You know, there's like very benign types of purpura, like solar purpura. And then you have like the horrible stuff like the septic purpura and like vasculitis and vasculopathies and things like that. So GHKCU, does that, do I see that improving, like scarring on the face? Not really, no, to be honest with you. Is there a way to clear hyperpigmentation? And then I think the person said like they're on Accutane. So a lot of times you just want to kind of take it easy. Like when you're on Accutane, you just kind of want to get that under control and get your acne kind of calmed down. And then at that point, then you can like really focus on, there's a lot here, bro. Then you can use things like remedy for dark spots and those kind of things. So also of course like lasers can be done. Thank you, bro. Oh, right on us, bro. Oh shoot, that was close. Move it up to E. Just need a grenade went off at just the right time, bro. So some kind of drone buzzing, bro. I was friendly. I'm down, bud. Car just rolled up. Car's down. I'm down though still. Ready for revive. 10%, right by the bunker area here.
You're over there.
Yeah. I feel like you can get me, bro. Charge the gunfire, bro.
There's a gunfire.
Come to get me, come to get me. Give me that full charge, bro. Don't give me that half health. I'm getting greedy with it now. PIE, your best bet is gonna like literally be doing laser for that, but you can also use things like, you know, niacinamide or tranexamic acid. Those are gonna be some good options you can do too. But really, laser is gonna be like such a dramatic, nice difference in improving redness faster. Also, if you just give it time, you know, some of that redness is gonna fade on its own. Kanye. Thank you. Oh, why did I peek? Canova, help me. Canova, no. Canova got murked. So just 10% missile peroxide. You can try that for the chest and the back. It's not like, it's definitely, if it's bad true cystic acne, probably not going to do the trick, but definitely the great like first thing to try. You know, like you definitely need to give that a whirl. You know, 10% chest and back is like a great thing to first try. Develop bald spots in the beard out of nowhere. What that is a condition called alopecia areata. So that's alopecia areata. It's a type of immune related hair loss that's fairly unpredictable, and it can be treated. You know, for some people the treatment works well. Some people it happens just for a little bit and then it goes away on its own. You never kind of know. There's different ways of doing it. So greatest preventative measure for HS. I mean, the one thing that you can manage to do and try to prevent is going to be doing things like antimicrobial cleanser. You definitely got people close to you there, Boo. You probably know that though. Grenade going in over there. Here with you, bro. Assault class. No, there's people to the right, bro. Oh, they're friends. They're friends. They wrapped.
Friendlies, right?
We got friendlies here.
Oh, did you hear about that? I don't know if you heard about that.
Oh,
yeah. The contestant in the Miss America pageant that has alopecia.
No.
Wearing a wig.
No. She did. She won it wearing a wig, or
won the state. She won the state one wearing a wig.
Oh yeah. Did she? Did she ever just go without a wig?
She did. First time for like the first.
Yeah.
Right before like the the U.S. pageant tonight.
Well, okay.
For her opening night. I guess there's a couple nights. You know what I mean? Yeah, she went without it.
That's very cool. I mean, I think that's awesome that she like went without it, because things like vitiligo and like alopecia, you know, it's like there's supermodels and stuff with these things now, and like it's hopefully less stigmatized. It's obviously things that, you know, they can kind of control that, you know, it's like it's your body. So I think embracing it is like very beautiful. That's awesome if she won though. And then like, yeah, if you want to wear a wig, wear a wig. If you want to just embrace it and, you know, roll with it, that's awesome too.
Right.
Thank you so much, you know, for the person who called out and said, hey, the laser treatment on my forehead looks good. I appreciate that. I agree. I think it's looking really good. I use Profractional. I think I went about 250 microns depth with 11% density, or maybe it was 22% density on my forehead. And then now I got it in my calendar, like how long that's been out, but I appreciate it. Boys, we coming in. And what's the move here? Just push to E, right?
Yeah, pretty much.
We need E. They're over there messing around that point, but oh, this is not like a. It's not like when we get it that we keep it, is it? It's like hold the most for the longest time.
Yeah, escalation.
How to prevent deep tissue acne. So really that, like systemic antibiotics like doxycycline, if you're a woman, spironolactone, Accutane. If you shave peach fuzz, will it come back thicker? No, it doesn't come back thicker or darker. That's like a myth. Is that a good sound or a bad sound? I hear a tank very close, and I don't see a blue tank on our map. That's not a good sign. How do you fix under eye hollows? You know, there's a lot of surgical approaches, doing like blephs with fat transfers and stuff like that. You can do filler under the eyes, but you really got to pick people carefully with that, because there's a very narrow margin for making things worse or making the eyes puffy. you know, so a lot of times I talk people out of it. So you want to find the right person for it. Oh, that's right. So, what was the best things for help KP? I like amlactin and CeraVe SA cleanser. Pitted acne scars, kind of depends. If they're true like ice pick pitted acne scars, I like TCA Cross for that, which is a type of strong chemical peel that kind of irritates the walls of the scar and gets them to kind of like smooth over. But if they're like, there's a lot of different ways, like if they're rolling scars or that, like there's different, you know, and a lot of times there's more than one way that we end up treating these things too. Like it's not always done the same way. Why is it blocked? Is Tret good for hyperpigmentation? Absolutely. Not only does it reduce tyrosinase, like which is the enzyme that makes melanin, but it also turns the skin over faster, so you can shed some of that hyperpigmentation quicker. So definitely is a worthwhile thing for sure. Best way to get rid of milia: salicylic acid cleanser. Like one that's a really good one is like the CeraVe acne control cleanser. That's a really good one. So I go something like that. Whoa, there's so many. Oh my god. Yeah, I like peeked up
Just
over.
saw a body fly off the map.
Did you? Oh, is it Tank get him?
I don't know what happened.
Yeah. Does crushed Tylenol on pimples actually help? It doesn't. And what you're actually thinking about is crushed aspirin, because that's like what salicylic acid is like aspirin. But no, I would not do that. So yeah, I would not do that. Small bumps on the forehead, again, from that texture concern, kind of rotate your like alpha hydroxy acid, like a glycolic acid, rotate that with a beta hydroxy acid, rotate that with a tretinoin or like adapalene. That's probably going to be your best bet. So I do something along those lines. Do derms use RNs? I have an RN in my office. I am very different in the sense that anybody that comes to see me, I do everything myself, like as far as like injections and lasers. I do all my own consults. I do all my own injections. But there's plenty of people that do utilize RNs for injections and things like that too. So I gotta get my life together, dude. I need a thank you guys again for being here. Thank you guys for all the taps. We're almost at 50,000 taps, guys, which is crazy. Come here, sniper man. Give me up. Thank you, brother. Should I go on Accutane? It's up to you, you know. I mean, Accutane is the best medicine there is for acne. It's the only thing that can cure acne permanently. So I'm a big fan overall. Oof, oof, oof. Dupixent's a miracle drug, you know, for a lot of people. I mean, Dupixent's one of the best treatments. It's really the best treatment there is for eczema, honestly, especially when you look at like the risk to benefit profile. It's incredible. You know, it's very safe to be on. You don't need lab monitoring. It clears people out nearly completely. Beach Wi-Fi, thanks for the follow. Appreciate you guys. Thanks for all the follows tonight. EDS, thanks for the follow. You guys are amazing. If I don't, you know, other thing I tell people is like, if I didn't see your question, you know, obviously I try to answer everything I have. I take minoxidil for my hair, and I'll probably start finasteride actually pretty soon. I take oral minoxidil. I do 2.5 milligrams every day. I did 5 milligrams, but I started growing hair like really high up on my cheeks. Like, so I backed it off a little bit.
Get some Wolverine chops.
I pretty much had it, dude. I'm about to go on a run with a shotgun right now. Watch the feed. I'm about to go on a run. Nah, I just died. Did you laser get rid of it? It didn't get rid of it. I think it did improve it. Like, I think it's improved. That's a very important takeaway for these things. When you get cosmetic treatments, like, it's never like perfection is never the goal. If you can improve something, an acne scar, a line, your radiance, I mean, that's the goal. You can't pick yourself apart. I mean, you could, you know, you could look at a million different things and think, oh, I need to make this better, that better, this is not perfect, you know, like that's a recipe for absolute disaster. So you definitely don't want to look at things that way. Can I hit it? No. Beef tallow is bad. Beef tallow bad. You're welcome. No, happy to help. Like, I'm always here for you guys. So I appreciate you guys asking all the great questions, honestly. You know, that's... I got you, boo. Don't worry. Oh. No, grenade came up here and didn't. Does drinking a lot of water help your skin look healthy? You know, obviously staying hydrated, it protects your kidneys. It protects your kidneys. It does keep you healthy, right? But is it necessarily, like in kids and in older people, you can definitely tell skin hydration a little bit by like skin tinting and that kind of thing. But really, skin hydration is not super closely linked to oral hydration. So yeah. Shaving face with acne, if you're going, oh, Izzy, thanks for being here. And you're the #1 viewer, by the way, Izzy. You've been here the longest, so I appreciate it. Is shaving your face, like dermaplaning with acne, if you're going over active acne bumps, then in that case, you are likely to spread some of that acne bacteria and potentially get more breakouts. So you do want to be a little careful with that. So always a good idea to get the acne under better, you know, good control before doing stuff like that. Or, you know, a lot of people do microneedling, you know, and then the worry is, you know, you do microneedling over active acne. Again, you can share that, you spread that acne bacteria too. Yeah. Okay. Well, boo. Thinking about doing that one thing, you know what I mean?
Yeah, I was gonna call last call, so.
You want to, like, that's last call, or you want to do one more? What are you saying? Boolong, you there?
Oh.
Yeah. Hey, you there? You want to do like last call
My
now?
internet here. No, we can do one more.
One more. All right.
Yep.
All right, guys. Thank you guys so much. Keep the questions rolling in. I appreciate you guys being here again. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. The thing I was going to say is, if I, you know, I'm trying to answer everybody's question. If I didn't get your question tonight, make sure to just go to my like recent video, drop it in the comments of like either of my last recent videos, and I will answer literally every question. I try to do that for you guys. Any question that gets dropped as a comment on my videos, I'm going to answer it. I always like questions in the comments better than questions on DMs, because then everybody can learn from it. And there's really no shame in it. I mean, we all have skin. A lot of us have the same skin problems, acne, whatever it may be. So, just make sure. I'm in Indiana, Evansville, Indiana, Southern Indiana. Port wine stain, are you aware of there ever be a fix? Oh, for sure. I mean, you can do lasers for that and improve it greatly. So there's lots of great lasers for port wine stain. Yeah, sorry, Milan. Oh yeah, he got you in. Let's go, baby. Let's go, baby. So this is Battlefield 6. It's a great game. I applied to be like a creator for it, and they just have ghosted me. Like a creator, like I'd love to be a creator for it. Let me have them. Give me a piece of them. Better not land this chopper. You better not land this chopper. Things tore up. Redness on the face. How can I avoid it, bro? You definitely want to be using sunscreen, because any kind of UV exposure is going to like kind of exacerbate that. But laser is like your best option for reducing redness permanently. There are like green tinted moisturizers and sunscreens, like the LTMD UV skin recovery. It's a green tinted sunscreen that's very good, and that can be done and is very helpful. Whoa, sorry, RPG all the way up that high. Lip filler while I'm currently on Accutane.
I'm only getting 30 down.
30. Wow. So you just got
down.
That's
Yeah.
very weird. You maybe need to restart your router, huh? Or something, and just try that first. Can you even play this
I'll
right
figure it
now
out
or no?
tomorrow. No, it's playable.
Oh, okay.
30 down, 11 up.
Wow. Yeah, that's garbage. Red light therapy is the cherry on top. There's plenty of like evidence to show that it does work and help. So it's definitely like a perfect thing to do. Shaving, if you are dermaplaning your face and you're doing it like really frequently, you definitely can get more breakouts for sure. Like 100%. Definitely happens to people. So I usually tell people like every 4 to 6 weeks is pretty reasonable. If you're doing it like every day, sometimes you'd be a little bit more prone to get more breakouts. Okay. Woo! Woo! Any thoughts on keloids after piercing? Yeah, I mean, that's probably the main reason I see keloids, honestly, is from piercing. It's crazy that such a tiny little injury can cause like a big old keloid. I've seen like a 13 centimeter keloid. I mean, talking like this big from an ear piercing. So that's like the, you know, the crazy thing about it. So we gotta get up in there, boy. Get up in there. Get up in there. Oh. So for acne, 4 or 5% benzoyl peroxide cleanser and the La Roche-Posay adapalene at bedtime. That's going to be like your best bet for acne treatment at home. Actually just did a little video on that here recently. Ooh. Oh, Mark's down. Tap the screen. Go get down. Thank you guys. Let's bump it up to 50k, guys. If this has helped you guys, seriously, tap the screen. Run those taps all the way up. Tap, 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 tap. Run it all the way up to the top. Get the confetti when you hit the top. That really helps us, you know, fuel the stream up. Let TikTok know that we're helping everybody get their best skin. This has been an awesome night. Obviously, great night in general. Fordyce spots, I've literally tried everything to get those better. And no matter how aggressive, I've lasered, I've frozen, I've done all this stuff, and just no luck with that. So it's very, very challenging. I haven't really had good luck with that. I've tried everything. So cystic acne, Accutane is about the only thing that's going to help you with that. But again, a lot of people use the term cystic acne very loosely. And a lot of people that think they have like quote unquote cystic acne, they maybe just have regular comedonal acne, mild acne, you know. But if it's deep, it's thick, it's full, it's hurting, it's leaving scars with everyone, like, then, you know, it could be. Do you think cosmetic hair and derm can treat indented acne scars? Yeah, 100% for sure. We're gonna have a lot of tools in our pocket to do that. You know, fillers, biostimulators, subcision. There's a lot of different ways that we can do that. So there's absolutely, you know, something that we can do. Cosmetic derm, definitely the person to see if you're looking to like improve that. So usually gonna need something underneath to kind of support the skin. And then, you know, sometimes do like the fractionated laser treatments on top of it. There's a lot of different ways to do it. So it's a good question. PCOS, you know, that can be improved by a variety of things. So that can be improved by a variety of things. Birth control pills are like one of the most common ways that we treat it. But also spironolactone can help. Weight loss and exercise can help. So a lot of different ways you can go about that. But you're going to be more likely to have, you know, excess hair growth, acne, you know, so really want to get that, like, you know, improved. Thank you guys so much. I'm hoping to hit 50k taps tonight, guys. If you guys can get me to 50k, that'd be a huge. Haven't had a good 50k night in a while, so it would literally take you guys 30 seconds to run those taps up. Literally, if you guys tap that screen, you could run it up to 50K in 30 seconds or a minute, guys. We've had the best people here tonight. I appreciate you guys all for being here. It's been wonderful. So thank you guys so much. Run those taps up. We're almost there. Untreated ringworm, is it bad for you? You know, it can spread. You can obviously get more of it. It can get harder to treat. Thank you guys so much. 47K tabs, guys. 47K tabs. Let's get to 50K, please. Please, dude. 50K tabs. Big L for private healthcare. Tell you what, healthcare sure is complicated. Yeah, I don't know the way. The only way I really know to help people the best is if, honestly, if I was a cash pay dermatologist. It would be the most straightforward, cheapest, direct, no middleman. You know, that's going to really be the thing that honestly I could provide the most like transparent care and best care. Insurance and healthcare is just a complete, you know, racket, and deductibles are confusing. Nobody understands it. Part of that is on, you know, to blame on us as consumers and like that. You know, it's a tough system for sure. It's definitely not perfect. But also don't think that, like, you know, just doing like socialized government healthcare, you know, is probably going to be the end all be all either. You know, you see plenty of these plenty of the countries that have problems, big delays in care, you know, let people die with cancer, you know, with no treatment. So it's hard. There's not a really easy solution, right? You know, sometimes think it sounds easy. It's not. Do you play medic and does Battlefield Medic have SPF lotion? Yay, 50K, we did it, guys. Thank you guys for hyping the chat up, because I know I could have done it without you guys. I think you guys were hyping the chat so much, which I love. So we got a little butt sticking out there. Got him. Normal sunscreen safe. It's totally safe to do. I mean, if you're worried at all, you could lean into a mineral-based sunscreen, something that's not going to absorb in the skin. So, you know, you could totally you know, you could do that too if you needed, you know, if you're worried. But it's true as a, you know, redhead and less sun protection just built in. You do want to use it regularly, obviously. You want to use it regularly, and we do absorb sunscreen, you know, more than we probably thought in the beginning. But there's not like evidence of harm from that, you know what I mean? So you don't really have to worry. It's definitely better to protect your skin, because, you know, you definitely know if you're you know, cumulative sun damage does cause cancer. So you definitely want to like prevent that, right? It's not worth it to not use the treatment. It's like a lot of people you kind of hear saying negative things maybe about, like, for example, like HPV vaccine, right? It's like one of the things that like completely like basically eliminates risk of cancer. So, you know, it's like crazy if you're not basically getting that, if you have the opportunity. Thank you guys so much. I think someone said coolest dermatologist, so I appreciate that. Thank you. Appreciate it. This has been a great night. I appreciate you guys all being here. Does PRP under the eyes do anything long term? It's a great safe way to kind of improve the quality of the skin under the eyes. It doesn't act like filler, so it's not like it's going to be a replacement necessarily for filler. But for people that don't want to risk, you know, having eye bags, like if filler's overdone or something along those lines, it can be very nice in that way. You know what I mean? Oh my god, ammo, bro. How can you get rid of hyperpigmentation around the eyes? I would try Remedy for dark spots. Remedy for dark spots is a great over-the-counter skincare product that you can get, and it's like got 9 active hyperpigmentation fighting ingredients in it. So it's got about everything you can imagine to help lighten the skin, and it's not prescription, so you can just get it easily and try it. And you just know, it takes, a few months, kind of try it out. Even if you bought one bottle, it's $30 or whatever, and you can get it, kind of get a feel for it and see if that is doing the trick for you. How to get rid of razor bumps. The closer you cut the skin, if you're dealing with them on the groin, anything like that, you could try other things like chemical depilatory creams, Nair, things of that nature. Different ways of trying to help that. Did not have enough. Tips for hair loss in young females. Easiest thing you can get at the store is just get like Rogaine, and you can just put that on and just do it once a day, every day, 5%. That's going to be like your best for starting place. If you're wanting something that's like natural, you can do rosemary oil. That's been proven to be as effective as 2% Rogaine. But 5% is more effective than 2%. So like just use 5% Rogaine, honestly. The vitamins like biotin and things like that, they do not really have any great evidence for being effective. So I would not really do that. And it can interfere with lab testing. There is a good company called Wellble, and they make vitamins that are like don't have the like insane amounts of biotin in it. So that's something you could look at too. But this is bad. But honestly, the minoxidil is going to be like your biggest help. My KD, I don't know. Do you guys know how to check the KD? How do you check the KD? KD right now.
On your profile.
Okay, it's 12 and 5 at the moment.
Hit escape. Go over to profile.
Escape. Profile. 1.7. 1.7. Thank you so much. Appreciate it. I said that's good. I appreciate it. 1.7 KD. What else was I gonna say? I've said a lot tonight. Oh, I heard a medic coming for me. Was that you?
That was me.
Oh man, that was like seconds before. Oh, there we go. Come around this corner, big boy. I got something for you. Oh, peek, young blood. Can't hit nothing. Oh no, dude. I have the same headset. You like this one? I had a new one. I bought like the Audis Maxwells, but they're like partially wireless, and I think it's like hard to get it all hooked up with my system, my GoXR and everything. Tips on folliculitis, I would just say use like an antimicrobial cleanser, like use CLN, reduce some of that bacteria on the skin, because that bacteria in general, that's part of the problem with folliculitis, because some of the inflammation is coming from the bacteria too. So got you, boo. Keratosis pilaris, amlactin, and CeraVe SA lotion. That's the things you're going to want to lean into. Ah, come on. What's the best deal with acne and pimples? Like a 4% benzoyl peroxide cleanser and a bedtime use La Roche-Posay adapalene. Tazarotene, one of the strongest retinoids that there are that's prescription. A lot of people can't tolerate it, honestly, but it's great for anti-aging and it's good for acne. Isn't CeraVe trash and acidic? It is not trash. So, I mean, I'll just leave it at that. It's not trash. So, tips for scalp psoriasis. My favorite things for that is like Remedy for Dandruff. That's like one of my favorite things to do. And that's a shampoo that you can use. It has a mix of ketoconazole, which kind of reduce Malassezia yeast, which can be affected in this. So it has that. There's a tank coming, bro. Oh, wait, are you down?
Yeah, I'm done.
Okay, I got you. Don't worry. I'm gonna get out of here. I'm about to lose, bro. Let's go to E. Capture E and let's win this thing. Me and you. Get in here. Don't let that tank get you, bro.
Hide.
Okay. It's contested. There's two here. One here.
We'll have one on D.
Oh, look how throwable. Skin flooding. I mean, yeah. I mean, if you're dry, the more you moisturize, the better. Skin flooding actually was kind of more of a trend, like probably 2 years ago. But you know, if you're you know, moisturization is a problem for you. I mean, obviously we get in the winter months. I think the discussion of moisturization is going to be like more and more common. You know, like it's a very important point. Oh God, this tank just like rolled in here. I wish there was a way. Can I like melee this tank down?
Do it.
Try it. I'm like kind of freaking the tank out for sure. So tips on Accutane, just really great thick moisturizer for the body, like La Roche-Posay Tolerian Triple Repair. And then for like the face, I usually lean into CeraVe Moisturizing Cream. And then my favorite for the lips, this is key, is my favorite for the lips, like, you know, just Vaseline typically, but there is a really, really nice option called Dr. Dan's Cordybalm, and that is a hydrocortisone lip balm, which is incredible when it comes to, like dry, irritated lips. So I definitely would look at that. Man, this tank, man. Thanks for the follows, guys. You guys are incredible. I appreciate you. Acne scars, I mean, home microneedling can help, but it's really going to be more of like a treatment that you get with a dermatologist, like laser treatments, subcision. You know, you really need fairly intense treatments to really make a huge difference when it comes to acne scars. Contact dermatitis, the best thing you can get over the counter is going to be is hydrocortisone 1%. I mean, there's really nothing else you can do for it besides that over the counter. But when it comes to that, it's going to be allergy avoidance, right? The allergen, you know, you cure the problem. You've cured the problem if you avoid the allergen. So sometimes we'll take it all the way to the point of doing like what's called patch testing. And patch testing is what we do to find out what allergen is causing the problem. And once we know that, then you can avoid it, and that's like the ultimate cure, right? So yeah. So I always remind you guys to, you know, tap the follow, so that way if I go live, you kind of get the notifications, you know I'm up here, and you guys can learn like about your skin. If you got friends that love skincare and you kind of like this format, make sure to share my profile with them. I appreciate you guys being here. If you guys didn't get your question answered, all you got to do is just go to my most recent videos and drop the question in there. I literally will answer every single question that's a comment. So just drop it in there. If I didn't get your question answered, just go over to my profile now. You can tap that right now. Just go over there and ask the question on one of my 2 most recent videos or so, and I'll make sure to answer every one of those questions. So I'll do it. I really appreciate you guys. I think it's been amazing live, right? So it's been such a good one. So thank you guys so much. Again, make sure to follow, make sure to tap, tap follow if you guys don't already. Ask your question on my most recent videos if you guys haven't already, and I'll make sure to answer those guys for you. So thank you guys so much for being here. I appreciate you guys. I'm going to shut these things down. I appreciate you guys. I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So thank you guys all so much. Thank you. All right, we'll see you guys soon. Thanks so much, guys.